Dr. Bruce, I see you have some COVID-19 tests in front of you there. I know there's a lot of controversy, though, on the news media and social media, too. All sorts of different tests out there for COVID. How do we know these are actually good tests? What have you done there?
Yeah, so I vet everything as you would expect me to do, and this comes out of a lab. The hard part is everybody knows there's another verse to this song that we're not being told. Okay, the FDA was not paid to take a good look into them. What they did was they said, hey, we're going to allow these labs to create these tests, and then if they send us a test and they show us how they've tested their own tests and how accurate they are and all that seems to match up, then we're going to allow them to sell these tests. Okay. Well, in America, you get really good labs that do exactly that. There are some in other parts of the country, other parts of the world that were also selling tests that were not as specific. They weren't as precise. I don't know if they had, I don't think they were nefarious, but at least the FDA did not agree that they were very good. Okay. And so what I did was I found one in Georgia, here in the USA.
These are made in the United States?
Yeah, they're made in the United States. And of course they have the emergency use authorization because a lot of people weren't even filing for that. Once the FDA said, hey, we're going to allow you to go ahead and make tests. A lot of people made the test and didn't bother to even get a pre-emergency use authorization number. They decided not to file for it. They didn't even send in anything. They just started selling tests. And so that's why you saw these tests, and I'm sure you've seen them, they're $75, some of these things. Excellent lab, know exactly what they're doing and all of that jazz. And then you have some out there that are like for $30 and maybe like less. I heard $7, but that was from China, But I heard some of these really low numbers out there, and that's what that was about. So yeah, this is a test that, well, the NFL alums are using it to get them back to work. There's a lot that goes around. I hope the NFL gets to play this year, we're Kansas City. But I'd like to see the NFL alums. There's a lot of media people that are around there. Everybody that carries the equipment, that does whatever, they're using that. It's already been cleared. This test has already been cleared in Europe. So, you wait a little bit longer for the FDA to clear these tests. That's just kind of normal, though, for America. It just is. Yeah. And we're a little safer when it comes to some of those things. But this is really good. It's well on its way.
Okay. So if someone wants to get tested, they just have to call our office, 816-454-5433.
Great.